Hi, I'm Dr. Cristina Wood. I'm the Medical Director of Anesthesiology at the Colorado Fetal Care Center. I want to talk to you today about a novel innovation we created that has improved post-cesarean delivery, maternal mental health, and reduced opiate use. First, let me give you some background about why we think this is so important. In 2020, the Maternal Mortality Review Committee in the state of Colorado reported suicide as the most common cause of maternal mortality. The second most common cause was drug overdose. In 2022, the CDC published maternal mortality data from 36 states and found that mental health conditions are the most common cause of maternal mortality, almost doubling the second most common cause, which was hemorrhage. Overdose was included in their suicide calculations, so we can safely say that in the United States, suicide and drug overdose are the most common causes of maternal mortality. When we consider postpartum mental health disorders, we know that they disproportionately occur among the more than 1 million patients having cesarean deliveries in the United States each year. 1 in 3 women report elevated symptoms of postpartum mood, anxiety, and trauma. 1 in 5 experience severe acute postoperative pain, and this greatly increases their odds of developing chronic pain and long-term opiate use. There are over 200,000 cesarean deliveries at risk every year of chronic pain and long-term opiate use. Both the presence of pregnancy complications like fetal anomalies and the anticipation of a surgical procedure increase the likelihood of anxiety and depression in patients. The presence of these mental health symptoms in pregnant women is associated with higher reports of postoperative pain and lower maternal satisfaction with delivery. This places these patients at risk for long-term mental health disorders and substance use. This is considered such a patient safety issue that the Council on Patient Safety in Women's Healthcare developed a safety bundle to address maternal mental health. Fetal care center patients are at the pinnacle of high risk. Not only are they having cesarean deliveries, but they're also carrying an anomalous fetus. So for our study, Dr. Dempsey, our psychologist, and I decided to develop a non-pharmacologic, low-cost, single-session intervention to reduce maternal mental health symptoms and reduce postoperative opiate use. We titled it Brief Exposure in the Operating Room, or BOR. This study is unique and novel as it focuses on a preventative rather than reactionary approach to addressing maternal mental health by refining and testing a low-cost, non-pharmacologic single-session intervention. And it can be delivered to all at-risk patients. It includes 2 parts. First is psychoeducation to explain the rationale of the intervention to the patients. The second part is a brief exposure to the operating room and all of the procedures involved in the cesarean deliveries. You can see in this table that we walk patients through their admission, their intraoperative care, and their recovery, allowing them to interact with the environment and ask as many questions to make them comfortable. The entire intervention takes less than an hour. For our study, we randomized 20 patients that had fetal anomalies and planned cesarean deliveries, and they were randomized to either treatment group or the care as usual. The study team scheduled the intervention with those randomized to the intervention arm within 1 to 4 weeks prior to the planned cesarean delivery. And the sessions were scheduled on a date and time that were convenient for the study participants and the intervention staff. Our preliminary data has been very exciting. Our analysis indicated large and significant effect sizes in this small sample. We reduced preoperative anxiety, postpartum state anxiety, and opiate use. You can see in this slide the actual effect sizes. There was a 42% reduction in preoperative anxiety, a 40% reduction in postpartum anxiety that lasted up to 8 weeks after the intervention, and a 75% reduction in opiate use postoperatively. This was followed for the 4 days of inpatient admission after their surgery. So we were very excited to see these improvements. And we have decided to also gain funding to enroll other fetal care centers. So you can see in this slide, this is our schematic of where we hope we will go. We have 4 fetal care centers also enrolling patients and studying this novel intervention. With enough data, we're hoping to be able to advertise this to all fetal care centers and all labor and delivery units to improve maternal care. Thank you so much for taking the time to watch this video. And if you want any more information, please visit our website at the Colorado Fetal Care Center.